Welcome to tonight. Tonight is our Half Heart Health is on home remedies. Now, this is important because, you know, even though like a lot of the remedies are first aid and they're stuff that you could just put around your house, what's more important is that you understand the reasoning behind it. So like if you look at, thanks Laura for closing that. If you look at asthma, so what do you do for a home remedy? Let's say you've got a relative staying with you and they've got an asthma attack. Now, when we talk about the cure for asthma and lung diseases, you know 5,000 people a year die from it, and 4,000 of those 5,000 die from the drugs used to treat it. So how can you help at home if you've got a relative that has a problem with it? Huh? Do you want to know?
Relative or not?
Well, kind of. Well, first off, I mean, obviously, if you had hindsight, you'd send them over to the chiropractor, they get adjusted, and they wouldn't have asthma. Okay? And also look at the triggers, because a lot of the things, severe asthma attack, these people are starting to turn blue, they can't talk, that's a medical emergency. You know, there's no home remedy for that. That's call 911, it's throw them over your shoulder, bike ride them to the hospital, get a taxi, just get them to the hospital as quick as you can, because if they don't get oxygen, they're going to die. The home remedies are for mild to moderate attacks. And this is when they're coughing or they can still breathe. So what you do, there's a number of things you can do. First off, asthma attacks can be triggered by toxins, so get them outside. You know, it might be something that they smell inside, it might be, you know, paint fumes, it might be something, perfume. Get them outside in fresh air and get them a lot of water. Asthmatics have 10 times the amount of mucus in their lungs because they're generally dehydrated. Even the drugs they use to take it further dehydrate their lungs. So get them water immediately. And then also, there's reflexology points, and this is kind of unique. Now you can experiment around. And the picture that you'll see on here, the foot, it's kind of right underneath the knuckles of the foot. You apply pressure, hold it for a few seconds up to the point of pain and discomfort. And if they're having an asthmatic attack, that's going to be very, very tender. And you put pressure there for about 5 to 10 seconds, go all around that area, and you're going to see it start to alleviate the attack. It's amazing. Okay, nice drugless. And even if you do have asthma, have the person drink several glasses of room temperature water before they do drugs. And they may not even require it. It's usually the lack of water that will stimulate it until you get them to the chiropractor and get them fixed. Okay, does that make sense? There's also a thing called contact healing. Now this is showing contact healing with the hands are lightly placed on the head. What this is you go in and you place your cupped palms on the front, on the chest, and on the back. But it should be very, very light, not with pressure, just about the like a feather touching, just like about the pressure of your clothes. So you just put your hand on the front and back of their chest and leave it there for a few seconds. Okay? And that will actually have a calming effect. See, with asthma, they can't get the air out. So they're going to be bent over in this like tripod posture where they're trying to force their gut contents to expel it. So asthma, vital. The home remedies, first off, it'd be better to fix it. This patient here obviously had chronic lung problems. Why? Because his nervous system had a problem. But now, what was his diet like? Was it the standard American diet? Yeah, it was. So he had very little fresh fruit, so almost no soluble fiber. And since his body responded to higher blood pressure, what did the doctors give him? Drug to lower it. Okay, that was a diuretic, which caused him to lose more fluid. Then he developed lung problems. I mean, it's just a stupid cycle. You know, comes in here within 90 days, his blood pressure's normal, his asthma's gone, you know, and we get him on more fresh fruit and vegetables. I mean, it's really that simple.